Hello, my name is Sidra Larkin, and today is February 28, 2019, and it is 2 o'clock. So today I'm going to be demonstrating how to place an NG tube, how to administer medication through an NG tube, as well as how to remove it. So first I'm going to make sure that all my equipment is gathered. I'm also going to check to make sure that there's a physician order. I'm going to go in, I'm going to introduce myself to the patient, and I'm going to make sure to get their name and date of birth. I'll also make sure to provide privacy. I'll provide hand hygiene, then I'll go ahead and place my gloves. I'll also want to go ahead and explain to the patient what I'm going to be doing so he or she has a good understanding of the procedure. I'll also make sure to assess the patient before placing the NG. So while assessing, I'll assess to see which nair is more patent. So I'll also want to check to see if the patient has had any surgery and if there's any nasal septal deviation. I'll also want to check for the patient gag reflex, and I'll want to check the patient mental status. Once everything is checked, I want to make sure that the bed is raised to a high phallus position. I'll also go ahead and place a towel over the patient. Now I'll go ahead and make sure to measure. I'm measuring to see how far I'm going to be placing this NG. So I measure from the tip of the nose to the air, and then from the air to the xiphoid process. Then once I have that, I'll go ahead and mark that area. Once I have that mark, I could go ahead and lubricate. I'll lubricate 4 inches. And once that's lubricated, I'll go ahead and ask the patient to hyperextend. And I'm going in through the left. Once I notice that it's in the oropharyngeal, I'll ask the patient to lean forward. And once I'll have the patient take sips, and once they take sips, I'll go ahead and go in some more. Once that's placed, I'm going to temporarily secure. Would want to make sure that this is all the way down to the marking, but being that it's a mannequin, sometimes it doesn't go all the way down, but we'll make sure that the tape is at the tip of the nose. So once that's secure, I'll make sure to check placement. When you first do an NG placement, you'll check for placement by doing an x-ray. You could also go ahead and aspirate gastric content, and you would want it to be acidic, so something less below 4. You could also listen over the epigastrium, and you're listening for a whooshing sound after you put in at least 20 to 30 ml of air. So once placement is checked, you could go ahead and fully secure the NG. Okay. Then I'll make sure I'll go ahead and connect this to suction, or if it depends on what the order is. It may need to be connected to feeding or something else. I'll also go ahead and connect this to the patient. You're going to connect it to the patient's shirt. I'll just use a safety pin. I'll go ahead and connect it. And I'm making sure that I leave room, so just in case the patient was to turn their head or anything, there's enough room. Once that's done, I'll go ahead and document how the patient took the procedure. I'll also want to make sure that I'll document if there was any secretion, anything that was suction. I'll document the drainage and what was actually suctioned and what amount. I want to go ahead and lower the patient's bed back. And make sure that the patient call light is also in reach. Then I'll go ahead and lower the bed back into the right position. Once that's done, if I was going to administer medication, I would make sure to give the patient a break. I wouldn't want to go in right after. So like maybe 30 minutes, I'll go ahead and make sure that I have all my medication together. I'll go ahead and crush my medication, making sure to do these separately and not together. I would mix it with 20 ml of sterile water. And then I'll go ahead and put my gloves on. While administering medication, before doing so, I would also go ahead and introduce myself to the patient again. Make sure to provide privacy as well. I'll let the patient know that I have his or her medication and let them know what I'm administering. Before giving medication to an NG tube, I want to check for placement as well. So I could check by doing the gastric content, or I could listen for the whooshing sound as well. Then I'll go ahead. I would disconnect it from suction. I'll go ahead and connect. And before giving the meds, I want to make sure to flush. And I'll be flushing with like approximately 30 mLs. I'm gonna go ahead and I was gonna use gravity, but that's not working, so I'll just go ahead and do that. So once that's done, I'll go ahead and get my meds. I would have this in my hand. Go ahead and rest this down. I would make sure, like while doing this, I wouldn't want to have that just sitting down. I could use the gravity, but being that that wasn't working, that's why I put it down. But that's what I would definitely do. I wouldn't want to just have this sitting down. I would wipe it off. Now I'm going to go ahead and administer my first medication. Okay, once this is administered, do the same thing. I'd also go ahead and flush. I'd flush again. Once I flush, now I could go ahead and administer my last medication. I would try to do something like that instead of actually dropping the NG tube on the bed. So I would get my last meds. Once that's given, I'll go ahead and flush one more time. My sterile water. I'll go ahead. Once that's done, I wouldn't want to connect this back to suction. If it was on suction right away, I would leave the patient up for 30 minutes so the meds could actually be absorbed, and I would clamp off the tube, the NG tube. I'd also make sure that the patient stay in a high phallus position for 30 minutes as well, because just like how we administered the meds, they'll stay in a high phallus position. And then I'll document what was given, how many medication was given, and what was done. I'll go ahead and also put the call light in reach for the patient and document as well as I said before. If we were going to remove the NG tube, we wouldn't want to do that. If an order was placed, we'd go ahead, go into the patient's room again. We'll also introduce ourselves, make sure that we explain what we're doing to the patient. Let the patient know that an order was placed by the physician, and of course we would have confirmed that before. We would have provided privacy as well. We want to also make sure that we had disconnected suction in for 30 minutes before. We also want to make sure that the patient was not, assessing the patient, we're assessing to make sure there's no nausea or vomiting. We're also listening for the patient bowel sounds as well. We want to go ahead, make sure that we have the towel. We're also going to have tissues for the patient, so if the patient wanted to wipe their nose after we're finished. We'll go ahead and disconnect the NG off. We'll also go ahead and take the tape off. Some patient may be very apprehensive about the whole thing because it was hard while placing the NG, but you want to tell them that it will be much faster than placing it, and it probably won't hurt as much. So we're going to go ahead and ask the patient to breathe, and to breathe in, deep breaths while we go ahead and take it out. Once that's out, go ahead. And then we'll go ahead and fill this out. And then we just want to wipe the patient up. And then we'll go ahead and make sure that the bed is in a comfortable position for the patient. We want to make sure that the patient's call light is in reach, and we want to make sure to document how the patient took the procedure, and if there was any secretions, if there was suction, we want to document the amount, the color, and everything that needed to be documented. Thank you.